Welcome to ENT Health 360, where we look at comprehensively understanding how your breathing can be improved and how the nose could be a cause of other issues. Today's episode, we're going to look at how one-sided headache or unilateral headache or pain behind the eyes, or it could also be the pain in the neck and shoulders, which is triggered by the nose and not the head. To understand this better, we've got Dr. Prashanth Reddy. Can you tell us a little more about Sluder's neuralgia?
So, Sluder's neuralgia is a issue which is most commonly associated with migraines. People will often associate this headache saying that, oh, I have a migraine kind of headache, which is very chronic, which has been there, which has not been diagnosed by anyone. They would have gone to multiple number of physicians, they would have gone to multiple neurologists, they would have gone to dentists, everything. So, what is exactly Sluder's neuralgia? Sluder's neuralgia is nothing but a nerve which is getting pressed inside the nose, which is in the back of the nose, which is getting pressed either by a bone or a cartilage, which is in turn leading to headaches, which can be across the head, in the side of the head, front of the head, back of the head, neck pain, shoulder pains, back pains. It leads to all these complex things. So that's why it's called Sluder's neuralgia complex and not simple Sluder's neuralgia. This is something which is very, very common, which is missed by many doctors and also by many patients.
Why is it missed? When you say missed, is it because the symptoms are very similar to headaches caused by something else? Or is it missed because people are not aware of it?
It's the latter. People are not aware of it, including ENT doctors, including neurologists, including physicians, everyone. So the main issue would be because lack of awareness, which is happening. And I kind of discovered this by seeing my patients who are getting the relief. I knew that the headaches which were caused by the Sluder's neuralgia is been there because again the term Sluder's is given to the doctor who identify this nerve which is getting pressed, which is called the anterior ethmoidal nerve, which usually presents with headaches around this area. It will be like a radiating headache kind of a thing. The reason why I've added the complex factor is because that particular thing is not just limited to headaches in around this area. It goes further outside also. It goes to your necks, it goes to your shoulders, it can go to your back as well. So once I started operating my patients and I was taking the follow-ups, that's when I realized that patients were getting relief after my surgery once the nerve was getting decompressed.
Okay. So, when you talk about nerve and nerve getting decompressed, right? It sounds a little scary because generally there's a lot of fear associated with nerves. Anything, even Botox and other things which can impact a nerve on the face can cause a lot of complexities. How complex is the surgery? How are there any negative effects of the surgery?
So obviously, when we say nerve is getting pressed, the first thing will be, oh my God, it's something associated with the brain. What will happen if the nerve is cut, or what happens? What is happening with respect to the the headache part and other things? So the main issue would be this whole surgery is absolutely scar free, absolutely zero cut, absolutely painless, absolutely zero bandage kind of a surgery because it's done within the nose. So we operate inside the nose using an endoscope. We'll go inside the nose, we'll decompress the whole nerve. And once the nerve is decompressed, the patients of mine see the results immediately, like once they wake up from the general anesthesia. So the patient will be under full body general anesthesia. There won't be any kind of issue which they will remember, or they will feel pain. That's the main what do you call issue most of my patients ask me, whether do I have pain, whether do I have will it be under local anesthesia or general anesthesia, what will happen. So from the patient's perspective, it's a very minor surgery. But from my perspective, it's quite complex because I literally have to go till the skull base. That's the the barrier between the nose and the brain. So I have to go literally till there and decompress the nerve. So for me, it's quite complex. But for the patient's perspective, it's a ultra minor surgery because they'll just go to the OT, they'll sleep, they'll wake up, headaches are gone.
No, again, but I'll bring you back to the nerves. Is there any risk involved to the nerve itself? Because you're talking about decompressing the nerve. So you're just relieving the nerve, or is there a risk of the nerve getting cut or anything like that?
So that's the whole point. So decompression. Why am I telling it's a decompressive surgery? So the nerve, which is so the bone which is straight is not straight. It will be bent. So this part is where the nerve is getting pressed. So because that nerve is getting pressed, you are having the symptoms. So once we decompress the nerve, so I'm not touching the nerve per se. I'm not cutting the nerve per se. I'm just releasing the pressure of the nerve. It's like you wearing a tight belt around your waist and how it's compressing your breathing and other things. So I'll just remove the belt around your waist and that will make you feel better. So there's no damage to the nerve per se as such, but the covering or the pressing on the nerve which is getting pressed, that is getting relieved.
Okay, that's really interesting that a nerve getting pressed triggers headache, I would have imagined. But you were talking about other symptoms also that get triggered. So can you just tell us what are some of these symptoms that patients have seen getting relief from?
So most of my patients were telling that their headaches vanish immediately after surgery. Like immediately when they wake up, the chronic headache which they have, that is fully vanished. They feel that they have the sinus kind of headache, which kind of gets triggered when they have cold or anything of that sort. That kind of gets relieved. They also complain of head neck pains, which will be there. Well, they'll have stiffness of the neck. A few of my patients also were telling that their shoulders were getting frozen, they couldn't move their shoulders. And a few more patients of mine were telling the upper back which was having spasms, those spasms are gone. And a few of my patients also have told that the back pains which were there, that back spasms, even I had a patient who had been operated for the spine and still he was wearing a back brace when he was walking. And after my surgery where I decompressed the nerve, he's telling that pain, back pain, even after a spine surgery which was not relieved, got relieved immediately after surgery, and he's walking around without a belt. So these are the small fraction of things which get relief of the patients.
I think that is why we bring it back to that topic of 360, right? I think there's a connection between everything in our body. Talk about acupuncture and other things which speak about putting pressure in a particular area which relieves something else. Our body is very complex. I think you figured out one place which relieves a lot of other things. And similarly, I think our body is complicated. And this is something which is very different. Not many doctors are doing that, if I'm not wrong.
Yes.
Are there many doctors doing this surgery?
First and foremost, not many doctors have identified that this is interconnected. So that is where the lacuna is. So identification that this is interconnected to the whole body is something which first and foremost we need to have more research on, have more collaborations, have more talks on, and then the solutions can be more far-fetched, wherein other doctors also can start doing it. So it's all about having the open mindset to understand, yes, we have other interconnected system, because your body is not one super specialized place where you are operating. So it's basically you have to have the whole thing of saying that, yes, as you told, 360, the whole body as a whole, 360-degree view is required. And that's the whole point why we need to focus on the interconnections which are there, how everything is interconnected. Because most ignored part of the body is the nose, whereas it is one of the most important organ of the body, because without the nose there's no breathing, and when there's no breathing there's no life.
Uh, that's a very good point. When we talk about 360 degree, again, is it necessarily just the bent nose which is triggering all these things, or could it be something else? Could it be the diets, allergies, or something else that is also triggering this? Or how do you identify particularly that it's this?
So in order to identify this, particular issue, I would ask my patients to get a CT scan done, because without a CT scan, I won't be able to tell much. So that's the first thing which I'll ask my patients to come back with, to decide on what kind of surgery, where the nerve is getting pressed, what kind of symptoms it's leading to. Once that whole thing is understood, then once the decompression is done, then we can take it forward. Another interesting thing of this decompressive surgery, it also reduces the allergies. Because that also factors in as a trigger point within the nose, which will lead to allergies, and those allergies can lead to further issues of sneezing, coughing, asthma attacks, and other things.
So, is it safe to say that sometimes maybe there are symptoms, but if you see the CT and you identify that there is no compression, right? In those cases, that can be probably treated with medication alone,
Yes.
and a surgery may not be needed.
Yes, exactly.
But with the CT, when it's very clear that there is pressure, there is a compression of the nerve happening, that is when we have to go ahead with the surgery.
Yeah, exactly.
Right? So that call can only be taken with the CT film.
Yes, that's exactly why I advise my patients get a CT film, because even with a nasal endoscopy, I won't be able to see how far deep behind is the bend, and also where exactly it's touching, which nerve it's touching. We can't be noticing it. So with the CT scan, we'll have a full-fledged understanding of how the sinuses are also involved. Because if there's a sinusitis also involved in the CT with an endoscopy, we can't pinpoint to which sinus is involved. So that also has to be addressed. Once we address that on the same setting, the symptoms will be fully gone.
So now that I understand, it's more like a switch. I think you've mentioned that in some other examples also. It's more like a switch. Once that switch is either taken away or you just make a direct connection there, the nerve doesn't get triggered and the symptoms don't appear, right? But do the patients still have to follow certain, rules? Do they have to follow certain diets immediately after the surgery, maybe, or prolonged diets or anything which is needed?
So I do give my patients a list of instructions to be followed before and after surgery. So those things have to be done, and especially after surgery, the most important thing is the washing or douching of the sinuses and the nasal cavity, which is very important to wash away the clots, because the clots also will trigger the nerves and can lead to headaches. So washing the nose is very, very important for ensuring that the whole healing happens. Once the healing happens, then this washing and other things will fully reduce or stop. And also, we would advise the patients certain lifestyle changes, especially like how they sleep, what angle they sleep, and other things. So once that is taken care of, the whole life will be a version 2.0 of themselves.
Okay. It's great to know that, it may not be a prolonged diet that you're talking about, but the diet would be needed. And there are some precautions that you still have to ensure that is followed, right? But when we talk about the Sluder's neuralgia itself, is this the same surgery which is done for a bent septum? Or if it is different, how is it completely different? I understand the nerve part, but is it similar or?
It is not, it is kind of similar, but not exactly the same, because with the septum bend, it's called, the surgery is called septoplasty, where only the front part of the septum is corrected, the cartilaginous part. What is required is also the deeper aspect which has to be addressed, and as I told, it's a skull based surgery. So we have to go till the skull base to decompress the nerve. And also that bone which is compressing has to be removed in toto. What happens most of the time with the septoplasty, only minimal, very conservative, ultra conservative manner has been performed, and that would relieve just the breathing improvement, but the headache relief and the weight loss relief won't happen.
Okay. So, is it safe to say that, or safe to assume that when we talk about correction of the septum itself, the more advanced form of that is what you do, right? When
Yes.
you do the septum correction and also look at the skull base if there is a pressure on the nerves and relieve that. So, it's an
Exactly.
additional step.
Yes.
And it can be done with a single surgery?
Yes, everything can be done and will be done in a single surgery, including the sinus opening, at the same time without leaving any cuts or scars on the patient.
So, at the same time, even the sinusitis issues can be resolved?
Yes, exactly.
Excellent. So, doctor, Can you tell us what are the symptoms a patient can be relieved of once they go through the surgery?
So when a patient has Sluder's neuralgia and they undergo a decompressive nerve surgery, their symptoms, which can start off with a headache, with the neck pain, with the shoulder pain, with the back pain, all of those symptoms will go away, including if they have allergies, then allergies will reduce, and also asthma attacks will reduce, including acidity issues, if at all they have any, and the sleep will improve, and overall personality of theirs, the anxiety, depression, everything will reduce drastically.
Okay. Uh, Another quick question that I had was I've seen that there is snoring surgery that happens. Does this also help improve or reduce snoring?
Yes, so the snoring root cause would be the nose. So nose obstruction leads to the mouth breathing. Because of mouth breathing, the snoring occurs. So yes, once we fix the root cause of the nose, the snoring also will reduce in case it's in the early stages.
Excellent. And doctor, if we need to go ahead and get tested or check if the we are a patient for Sluder's neuralgia, or if that is the scenario that I'm facing, how do we get in touch with you? What are the steps that we need to take?
So you can come and consult me at my clinics. I have my clinic in Kormangla and also in Sarjapura Road. And post the consultation, I can assess you, and post that we can take a call.
Okay. And if we need to go ahead and go through a surgery, how long will that decision take? What is the procedure like? Is that I know it's not a very complicated surgery you mentioned, although it's complicated for the doctor's point of view, right? But from the patient's point of view, let's say today I come to your clinic, we meet, I have my reports, you look at my CT. How soon can I go through the surgery, and how soon can I get back to office or anything else?
So, if the moment you come and consult me and I advise you what needs to be done with the CT scan, once I see the CT scan, you can plan for the surgery the next day if you're all ready. If you have your insurance details, you can share it with my team. My team will get it, share it with the hospital. The hospital folks will get in touch with you and get the whole thing processed. And the downtime, which most of the patients will be worried about, there's zero downtime. If you have work from home, you can do work from hospital immediately after surgery.
Thank you so much, doctor. If we need to get in touch with Dr. Prashanth, here are the details. You could reach on this number, and the details of the clinic is available in the description. Thank you. Hit that like, share, and subscribe button for more bite sized health insights from ENT Health 360.